So today we're going to talk about how to administer the Diastat or the diazepam medication. When you look at the population and you know that the prevalence of seizures is 1 in 26, this is something that if you are a classroom teacher, you would most likely encounter. So it's really important to kind of have a good sense of how to administer the Diastat because it's very likely you will have to do this. Now, the Diastat may come with a set of instructions that may look like this, and you can, of course, laminate that and put that in your classroom, but it may not come with a set of directions, particularly if this is something that is a prescription order from a pharmacy. You might just get the Diastat that the parent may send you. So you have to really be familiar with this. So the first thing you do when a parent sends you the Diastat is to check the Diastat and make sure that the expiration date is correct, and also check on the dosage for the Diastat. So this is a Diastat that's really something that we use for training, and it's set for 10 milligrams. So you want to check this and you want to look at the dosage of the child in your classroom. You know, if it's 10, 15 and this thing is different, you want to change that by turning it. So the way to change the dosage is to just press this down, and it's a little dial. It will change it to the correct dosage. So let's say it's 15, you would just change it counter clockwise to 15. But generally, a 10 milligram is for typically for a toddler, it should be effective. So don't forget to check the dosage when you get the Diastat. You need to do this before any kind of seizure occurs, and you should do this as soon as you get one of the Diastats in your hands. That's the first thing you do, and then you put it away and hope you don't have to use it. But if you do have to use it, the first thing is not to get into a panic. The Diastat Administration I've discussed in another slide. In this video, we're going to just show you how to now go ahead and use the Diastat. So in your handy dandy medic kit that you receive, you would receive the Diastat. You will also receive the lubrication jelly or Vaseline. You might receive a single dosage or a single tube like this, or you might receive something that you have to kind of tear out, and it's a single use and dispose kind of thing. So either way, you'd have some type of lubrication in hand, and you should have some gloves, and these are just typical surgical gloves, but any kind of non-latex gloves or surgical gloves will do. Okay, so remember that you don't have too much time from the onset of the seizure. You have 5 minutes to make sure you get all of your stuff ready, and then hopefully you'll have somebody checking the time. So if the seizure does not stop at the 5-minute point or at the point where the prescription is written for, you are ready to administer the Diastat. So make sure you have all of your stuff, and then you put your gloves on. So we're going to perform this on our handy dandy doll, demonstration doll Chelsea. So this is Chelsea, our special ed doll. She's having a seizure, convulsive seizure. So what I want to do is try to help her to lie down. So she hopefully will be not too much of a struggle. So I'm going to try to get Chelsea to lie down. And I want her to face me because I want to make sure that I'm focused on Chelsea's face, and I'm looking at her eyes. I'm looking at the color of her face, particularly her lips, so that she's not getting blue, which would indicate a lack of oxygen. I want to put something soft underneath her head to protect her head. If you can't find a blanket in your classroom, go ahead and use any kind of soft thing that you can get your hands on. Remember, you don't have too much time, so even if it's a sweater or a bag, that's fine, as long as there's something protecting her head and she's not just jerking her head on the concrete floor. So you want to do that. Now, it's really important to have her face towards you, and then you want to make sure that you move one of her legs towards you. And this way, it's a little bit easier to administer the Diastat. So the first thing you do is you take the Diastat and you remove the lid. It just pops off. So you kind of push it with your thumb, you'll have it popped off. You should have checked to see the dosage is correct, double check to make sure it's the correct Diastat for the person. So I'll check to see if it's Chelsea and not somebody else's. I'll check the dosage, and now I would put the lubrication. So remember I said there's a couple of different types of ways the lubrication might be. This is a single lubrication. So I put the lubrication gel on. I want to close my tube. I'll hold this with my left hand. And now I'm going to pull down her clothes. So you would hold the Diastat with your left hand, and with your right hand you want to make sure that you have good access to the rectum by opening up the buttocks. So once you have that, you would take the Diastat and you would insert it very gently and very slowly. In fact, you want to count down this process. So you would count 3 seconds. So you go 1 Mississippi, 2 Mississippi, 3 Mississippi, while pushing the Diastat in. And you want to do it in 3 separate squirts slowly. If you do it too quickly, and I can understand why you might want to get this over with and just insert it very quickly, the medication would just come out and that would defeat the purpose. So you have to be very, very thoughtful in actually doing this slowly. Once you have administered the Diastat slowly, and you've done your countdown to 3 seconds, you want to close the tube butt cheeks to make sure that the Diastat does not come out. So once you administer the Diastat, you close the butt cheeks and you hold the butt for an additional 3 seconds. You'd go 1 Mississippi, 2 Mississippi, 3 Mississippi, close. And then of course you want to pull up their pants. And at this point they can either lie down this way facing you, or you can turn them back on their back. You would still continue to track time. This is very, very important that you track the time of administration, and you're also looking for now convulsions if it's continuing or not. So once you've administered the Diastat, you want to continue to check for time. You want to keep a record of the time, and you also want to keep your patient comfortable. That may mean that you may cover her up, just her leg area, and just keep her comfy. Also keep looking at her and make sure that her color is okay and that her breathing is okay. Once the person recovers or does not have a convulsion for another 5 minutes, then we call this the post-ictal phase. And this is the recovery phase, and you still want to keep an eye on the person.